Helms, and we are at CryoHealth of Kansas in the Tallgrass Shopping Center. This is the cryo chamber, and essentially people will get in here for approximately 3 minutes, and they will get into very, very extreme cold temperatures. It gets down to about -250. Through this process, their body goes into shock. All of the blood goes from the extremities into their core, and it gets filtered. This blood filters out toxins, it filters out lactic acid, and it also gets reoxygenated, so when it's put back into your bloodstream, it is fresh blood that might also pump out some of the feel-good hormones such as dopamine, norepinephrine, endorphins for some. And a lot of people use this for recovery. Athletes will do it in between their 2-a-days or before and after a workout to really help with the lactic acid buildup. A lot of people will use this for any issue related to inflammation because it really helps decrease inflammation in the body, and some people also utilize it for chronic pain.
Exciting when it opens. Oh, it is kind of exciting.
Yes.
That is really cold looking in there.
Yes.
Okay, so tell us how does the process work? What's Kristen going to experience when she steps in here?
When Kristen gets in here, she's going to be wearing 2 sets of gloves. She's also going to be wearing socks and slippers, and that's basically to protect her extremities. She'll get in there, and we raise her head to about 2 inches above that rim over here. And by doing that, we basically protect her from, being too exposed to nitrogen. It's a naturally occurring substance, nothing for people to worry about. But again, we just want to make sure that they're not breathing in too much of that because you want as much oxygen as possible when you're breathing. The other part is she'll be in here for about 3 minutes. We have people rotate a little bit just so they're not getting overexposed to some of the nitrogen where it comes out. And through that process, she's going to be exposed to initially temperatures of -160, and it'll go down from there for the next 3 minutes. Her body is going to start going into that fight or flight response, and that's exactly what we want. It tricks your brain into going through that whole process and filtering things. And she'll experience cold, but it won't feel too cold. Your skin's never going to go below 32 degrees. It's not unsafe. You won't experience hypothermia. So the protocol for this is I see you have watch and a ring on. You're going to take your jewelry off and you're going to put it in this container, or you can put it down there if you'd like.
This looks like a safer place.
Probably. If you have any lotions or anything that's wet, that could include open wounds, fresh tattoos, you want to make sure you either cover it or you wipe off any sweat or lotion with the towels.
I'm glad I put off that tattoo.
Yeah, that's true.
There you go. There you go.
Okay, I did just wash my hands, but I'll make sure they're
nice.
dry.
And you'll also be putting on the white pair of gloves and then the black. And then you'll also put on the socks, and we have some slippers over here depending on your foot size.
Okay.
And once you have those on, those are really the only things you're required to have on. For women, undergarments are optional, but you can leave those on if you'd like as well.
Okay.
So
Great.
just no underwire with the
call
lady
on that one.
bras. Yep. So
It'll get super cold.
Yes.
yeah, but we do have like fresh new sports bras if you just want to put on a cotton sports bra.
Okay.
So
Okay.
yeah, it's totally up to you. We'll step out, let you do that. You'll step into the chamber.
Okay.
And there's a doorbell on the other side. We'll stop the process so it's not spewing nitrogen.
I'm like, do I just step in by myself? No one in here?
But you'll step in, ring the doorbell, and then we'll come in after you do that.
So you're at -100 right now. How do you feel?
It actually feels totally fine.
Really?
Yeah.
And you hate the cold?
And I hate cold.
Okay. Like how much do you hate the cold?
Quite a bit.
All right.
Oh yeah, now it's colder.
Okay, so what did you just turn? You just turned the cold on?
Yep. So I just turned the cold on so the nitrogen's starting to come out. And kind of what I mentioned earlier, about every 30 seconds or so, you're going to want to rotate a little bit just to prevent overexposure from that one area with the nitrogen. Nothing to worry too much about. Just an added precaution.
Okay.
So how's it feel?
It feels good.
Not too bad?
Yeah.
All
I'm
right.
surprised. Because to be serious, I really do hate me.
I do as well. Yeah. I'm there with you.
And it's at -160. Now, do we have that
Yeah.
little skin temperature where you can measure her skin temperature and see what that is? That laser, does that work in there? Let's see.
Let's see.
80.
80.
Oh, that's
Yep.
cool. That's for skin temperature. That's getting down there.
Yep. And you've reached all your benchmarks. It was down to -166 within 30 seconds.
Okay.
And now it's actually -223 degrees Fahrenheit.
Okay.
And it's measuring that temperature is the ambient temperature inside the
Cryo chamber.
wow.
Mm-hmm.
This is great.
That just boggles my mind that it's that cold.
Yeah. It really does feel good.
Okay,
I'm pleasantly surprised.
I believe you.
Yeah.
And it's great because again, it's not doing any sort of internal damage, and it doesn't feel as cold as it is, but
Yeah.
it's still triggering that response in your body for it to go into the fight or flight, for
Okay.
everything to rush to your core. And
So you're getting all the benefits of the fight or flight response without actually having, the damage that you would get from frostbite or something like that.
Absolutely, absolutely. And kind of as we were discussing earlier, there's a lot of different processes like exercising that also can, induce that response. And if it's not done too much, like if you don't over-exercise or if you're not putting this extreme cold all the time, then it's not a bad thing. It's not going to put fatigue on your system.
Yeah.
It can be a very good thing for you.
She's turning more frequently now.
I know. Are you getting a little chilly?
But it's different. It's not like a deep, when you've like been outside at a football game for too long and it's like a deep
Bone chilling cold.
It doesn't
right?
feel that way.
Your voice is shaking a little bit.
You're starting to chatter.
Yeah.
But you're doing great. You only have about 20 seconds.
Awesome.
When we're done with that, we're going to press stop and we'll
20
head out
seconds? I
here.
feel like she could go another 30, don't you, Kristen?
I'm good.
No, she doesn't.
Like biting your legs a little
Record.
bit.
All right, Kristen, so you just got out of the cryo chamber.
I just got out of the cryo chamber, and I have to say it was actually a really pleasant experience, and that's coming from someone who doesn't like cold. It didn't feel painful. It was funny because I noticed I started chattering, my teeth started chattering a little bit, but I didn't feel that like deep bone cold that you get when you're like outside in the cold for a really long time. And I don't know, it was a nice, I kind of feel like invigorated and like I could go run or do something with a lot of energy. So I'd say overall it was a really good experience.
Wow, that's cool.
Yeah.
All right, well, I'm excited to jump in and try. All right, so Kristen's doing the cold cryofacial. Is that what we call that?
Cryofacial, yes.
I don't know.
So not as cold as the chamber, Kristen?
It's pretty chilly,
Yeah.
but it feels really good.
So this would be good for lots of inflammatory conditions. People have like inflammatory acne maybe.
Yeah.
Acne, eczema, stimulates collagen.
You're welcome. I have this microphone.
That's cool.
And decreases inflammation. And really, the acne, when it gets inflamed.
It's hard to treat.
And painful. It's really cool.